For this module, we'll be talking about coping with vertigo through the Epley Maneuver. So the objectives for this lesson, at the end of it, you should be able to define vertigo, identify the causes of vertigo, identify the manifestations of vertigo, identify the purpose of Epley Maneuver, and identify the correct sequence of the Epley Maneuver. So what is vertigo? Vertigo is actually a disturbance of the inner ear, and primarily it affects the body's sense of balance. And usually this is associated with the imbalance in the endolymphatic fluids, specifically in the inner ear. So this leads to a sensation of spinning, revolving, or rotating. So what causes vertigo? Actually, it's caused by a variety of factors, and one of the most common types of vertigo is called the benign positional paroxysmal vertigo, or BPPV. And usually, it has a lifetime prevalence of 2.4% among the people. So it's actually a common manifestation of an underlying medical condition, and treatment of the underlying cause of the vertigo leads to the eventual treatment of vertigo. So to remember the causes, let's use the code Cavesman, which refers to the following conditions that may cause vertigo. So Cavesman refers to cold viruses, a head or neck injury, vestibular neuritis, or inflammation of the vestibular nerve or the eighth cranial nerve, stroke, and Meniere's disease, a medical condition affecting the inner ear characterized by tinnitus. Symptoms of vertigo, I actually have formulated the code that is actually specifically represented by um, the word vertigo. So you have here a code that will make it easy for you to remember the signs and symptoms. And then the purpose of Epley Maneuver, it's actually a way of treating vertigo at home, and this involves a series of steps done before bed that requires the patient to assume different positions. So if symptoms of vertigo occur from the left side and the left ear, the Epley Maneuver can be done by following these steps. Step 1, sitting on the edge of a bed and turning the head 45 degrees to the left. Step 2, lying down quickly and facing head up on the bed at a 45-degree angle. Step 3, maintaining the position for 30 minutes. Step 4, turning the head halfway or 90 degrees to the right without raising it for 30 seconds. Step 5, turning the head and entire body to the right side and looking downward for 30 seconds. Step 6, slowly sitting up but remaining sitting for at least a few minutes. And always remember, if vertigo starts on the right side in the right ear, the direction should be done in reverse. So let's evaluate. Let us try to answer a few questions. Question number 1. A 40-year-old patient arrives at the emergency room of the hospital. When asked about what brought her to the hospital, the patient replied, "I was sweaty and I feel like everything around me is spinning." The nurse correctly identifies this symptom as that of A. Tinnitus, B. A. Nystagmus, B. Vertigo, C. Diplopia, or D. Tinnitus. The answer, this is actually associated with vertigo, the feeling of revolving motion. Which of the following factors are considered as a cause for vertigo? Select all that apply. Neck trauma, yes, it is a risk factor. Cold, yes. Stroke, yes. Head injury, yes. Inflammation of the vestibular nerve, yes. Injury to the outer ear, no. Meniere's is actually caused by injury to the inner ear. Which of the following manifestations is due to vertigo? Select all that apply. Vomiting, yes. Nausea, yes. Double vision, yes. Weakness, yes. Ringing in the ears, yes. And sweating. So all applies to the signs and symptoms of vertigo. Question number 4. Epley Maneuver serves as a home treatment for which of the following symptoms? So for this question, is it A, jerky movement of the eyes, B, dizziness, C, double vision, and D, ringing in the ears? Epley Maneuver is used to relieve vertigo or dizziness. So the answer is B. Again, for question number 5, a nurse is assisting a patient with left ear vertigo to perform Epley maneuver. The patient is initially placed in a sitting position and please arrange the steps in order. Lie quickly. Yes, that's step number 1. Maintain position for 30 minutes. Yes, that's step number 2. Turn the head halfway. That's step number 3. Turn the head and the entire body and look downward. Step number 4. And slowly sit up and remain seated for a while. This is step number 5. Thank you.